Alright, so this down here is the gallbladder. This is the common bile duct. That's the proper hepatic artery which comes off of the common hepatic artery. This is the hepatic portal vein right here. All this blue in here is part of the hepatic veins, and you can actually see them coming out right here. This is the inferior vena cava. This is called the quadrate lobe. This is ligamentum teres hepatis, which comes at the end of the falciform ligament. Falciform ligament has the sole responsibility of separating your left lobe of the liver from your right lobe. Coming straight across all the way around the liver is called the coronary ligament. Coronary has to do with heart. This is basically where the heart is going to sit when it's on top of the diaphragm, so just opposite side. This is the caudate lobe. Quadrate lobe in here. Now the word for gallbladder is cystic, okay? Common lecture question is, what is the name of the surgery in which a gallbladder is removed? A cholecystectomy is the answer. There. So the common bile duct has two branches. There is a common hepatic duct which goes to the liver, and the word for gallbladder is cystic, so you have a cystic duct going to the gallbladder. On some models, I haven't been able to find, this one right here. There is an artery wrapped all the way around the gallbladder. So the word for gallbladder is cystic artery. We don't overcomplicate this shit. We overcomplicate other shit, okay? Just so y'all know. I like this model for the gastric, colic, and renal impressions. The reason is because these models are cut open so you can actually see like all these vessels and stuff going in them. These ones are not cut, and because of that you can actually see each individual indentation or impression. So you have three organs that make impressions on the liver. Stomach, which is on the left side, colon, which is on the right side and anterior, and renal or kidney, which is on the right side and posterior. When this is in anatomical position, this is how it should look on me, like this. Okay, so from your guys' view, it should look like that. This is the left lobe. Stomach sits on the left side. Gastric impression. Makes sense. There is an impression here and an impression here. This impression is more anterior when it's in anatomical position. So this is the colic impression. It is also right next to the gallbladder as a reference. This one back here is the renal impression. The renal impression is right next to the inferior vena cava. Okay? So that's how you know the inferior vena cava is always posterior and the gallbladder should always be anterior in anatomical position.